Life vest for cardiac patients. So the past of it is pretty much in 1700s, electricity was discovered. And in 1791, Galvani discovered that muscle contraction happens because of electrical current. At the turn of the century, from the 1800s to the 1900s, people were beginning to live longer, and as they increased in age, they also increased in heart problems. So cardiac arrest and other heart problems became a big issue, or started to become more of an issue. So in the early 1900s, Claude Beck established heart surgery. He also discovered a way to revive heart attack victims. Beck was a person who conceived the ideas of a defibrillator and CPR. His first defibrillator was made in 1947, and it was an open chest defibrillator. He had to open up the chest to defibrillate the heart. In 1957, Paul Zoll successfully established the first closed chest defibrillator. So here on the left you have Beck's defibrillator, and on the right you have Zoll's, and his is pretty much prongs that stick into the heart instead of actually opening up the chest to get to the heart. So in 1972, Stephen Hellman started working with Michael Moransky on a project that Moransky was working on. They successfully created the implantable cardioverter defibrillator. This implanted device helps prevent and treat sudden cardiac arrest. So there are two kinds of patients for this device. First, you have patients who have survived the cardiac arrest or another heart problem. Then you have patients who have not had a cardiac arrest but are at higher risk. And there are also patients who get declined for this defibrillator because of medical reasons, like it's too risky to open up their to actually implant this. But the implantable cardio defibrillator uses electrical shock to control the patient's heart rate. In 1986, Hyman founded the company LifeCore and successfully created the wearable cardioverter defibrillator. So right here on the left you have the implanted device, which that little white thing is implanted in the chest, and it sends shock to the heart when it needs it. And on the right you have the vest. So the wearable cardioverter defibrillator was created to monitor patients in a cheaper way. It was also created to monitor the patients that did not qualify or could not get the implantable device. So instead of patients, having overnight stays in the hospital to monitor their heart and having to pay that $2,000 or having their insurance pay $2,000, they instead had these cheaper vests that would monitor their heart, and they could actually live their life instead of be stuck up in the hospital. Patients who are at high short-term risk are most likely to have the vest, while patients who are at high long-term risk are most likely to get the implanted device. The implanted device costs about $65,000. If the patient is conscious, they have about 20 seconds to, turn their alarm off and be like, hey, I'm fine. But if the patient is unconscious, after that 20 seconds, you got the shocking electrodes that deploy the electrical shock, and then the defibrillator that actually does electrical shock to the heart to bring it back to a natural rhythm. So you have the modern day implant. The implanted cardioverter defibrillator is a battery-powered pouch that is generated by pulse that is implanted under the skin in the patient's chest, right above right below the shoulder. When it senses a slower heart rate, the defibrillator will send an electrical signal to regulate the heart rate. So the future of this. Chaotic Moon Studios in Austin, Texas is currently working on a temporary tech tattoo. Although this is not used for cardiac arrest just yet, I can see it one day being used for that. This tattoo right now is to monitor vital signs, to get your heart rate, just blood pressure and vital signs. So this tattoo, if they can one day make this tattoo where it would, once it senses that your heart rate drops, then it would send an impulse, and all you have to do is just have this tattoo on your chest instead of going under surgery or carrying that big vest on you. This would be a smaller, easier, cheaper way to have it.